Thanks very much, everyone, and good afternoon. Thank you for coming at short notice. I understand I've left you waiting for a considerable period. I'm sorry for that. I've just come from a number of urgent emergency management team meetings over the course of today. We have an emerging and serious issue we need to update the community on. Today, Victorian Health received the test result of one of the people in the immediate adjacent room to the cases involved in the Mercure Hotel intra-room transmission. The male in his 50s is COVID positive and is currently in hotel quarantine in Melbourne. He was one of two people in immediate adjacent rooms. The other person has returned a negative test result and will complete 14 days of hotel quarantine in Perth. There were 16 other people on that specific floor who have since left hotel quarantine. These people were not in adjacent rooms. So far, we have received 13 negative results, with the remaining results due shortly. But back to the case in Victoria. This case arrived in Perth on April 3 on flight SQ223 after spending time in Shanghai. His room was alongside the family from the United Kingdom, so he was opposite the couple from India, but one over to the right. He returned a negative result on day 12 in hotel quarantine and was then subsequently released on the 17th of April before leaving for Melbourne on the 21st of April. This means he spent up to 5 days in Perth, and we now need to assume he was infectious during this 5-day period. I will now go through what we currently know, but I want to say this. This is a fast evolving situation, and we're acting on information that has just come to light. Because this person is in Victoria, we've immediately mobilised teams to begin contact tracing. So far, this is what we know. A more detailed summary of the locations and specific times will be released later today, when we have that information finalised from our contact tracing teams. Generally, this is what we know. After leaving hotel quarantine on the 17th of April, he stayed with a friend and her 2 children at their home in Sardinia and went to a Malaysian restaurant. That friend who is a close contact, had a rapid COVID test today, and that has just returned a positive result. On the 18th, the Victorian case visited a swimming pool in the southern suburbs. He had a coffee in Leeming, a dinner in Northbridge, and then stayed at St Catherine's College at UWA, which offers short stay accommodation. On the 19th, he visited a Chinese traditional medical doctor, went to Northbridge again, and again stayed at St Catherine College that night. On the 20th, he visited Kings Park and Northbridge again. On the 21st, he had breakfast in a common area at St Catherine's College before being driven by his friend to the airport. He boarded flight QF 778 from Perth to Melbourne at 1:05 p.m. that afternoon. That flight had 257 passengers, and Victorian Health is working on contact tracing those people. For any Western Australian who was on that flight and has since returned, you will be required to be tested immediately and self-quarantine for 14 days. That is QF 778 from Perth to Melbourne on that occasion, the 21st. So in summary, we now have 2 positive cases that have been in our community from April 17. Details and locations for both the Victorian case and his friend will be finalised and released publicly as soon as possible. If you have been to these locations during the times listed, you will need to get tested and isolate until you return a negative test result. If people are deemed a close contact by public health officials, you will be tested and required to self-quarantine for 14 days. We're also obtaining CCTV vision to piece together more details. We know his accommodation at St Catherine's College at UWA had or has a separate bathroom, which is good news. We're scaling up our contact tracing and COVID testing teams. Health will be sent into St Catherine's College to test people. So anyone at UWA, if you're feeling unwell, you need to get tested as soon as possible. As a result, we need to act and do what is necessary to prevent further community transmission. We've gone more than 12 months of no community transmission, and our lives in Western Australia have been normal compared to what we have seen around the world. We need to do everything we can to protect our way of life. That's why from midnight tonight, Perth and Peel will enter a 3-day lockdown over the long weekend until midnight on Monday night. I know this is hard to take, and I wish we didn't need to be doing this. But we can't take any chances with the virus. We just can't. From midnight tonight, people will need to stay in the Perth and Peel regions and won't be able to leave unless you have an exemption. There will be 4 reasons to leave your house. These are: work because you can't work from home or remotely; shopping for essentials like groceries, medicine and necessary supplies; medical or healthcare needs, including compassionate requirements and looking after the vulnerable; and exercise with a maximum of 4 people, limited to 1 hour per day, and masks must be worn unless it's vigorous exercise. Masks are mandatory from 6 p.m. tonight and over the 3-day lockdown for Perth and Peel residents, and we recommend they be worn immediately. If you have left Perth and Peel since the 17th of April, you'll be required to wear a mask whenever you are in public across WA. Over the short 3-day lockdown, you must wear a face mask unless you're in home, in your car with people you live with, or doing vigorous exercise. Masks are not necessary for children under 12. The following facilities within the Perth and Peel regions will need to close over the course of the lockdown: pubs, bars and clubs, except for takeaway; gyms and indoor sporting venues, no community sport is permitted; playgrounds, skate parks and outdoor recreational facilities; cinemas, entertainment venues and casinos; large religious gatherings and places of worship; and libraries and cultural institutions. The following restrictions will apply for the lockdown period. People can enter Perth and Peel only to access or deliver essential health and emergency services and other essential requirements, or returning residents. Restaurants, cafes or pubs to provide takeaway service only. No visitors to hospitals or residential aged care or disability facilities unless there are exceptional circumstances. Weddings and funerals will be permitted, however, with a 100 patron capacity, not including staff, and masks must be worn. This will be the only exemption for restaurants and other event locations for weddings and funerals. I know this 3-day short lockdown is very, very difficult, but I hope we can keep it to 3 days only. Give our contact tracers and health teams the time they need to ensure community spread is limited. Unfortunately, Anzac Day dawn services will be cancelled in the Perth and Peel regions. I encourage everyone to take part in the driveway dawn service again this year. I will be doing that again. We will be monitoring this all very closely here on and continue to assess the situation as more information comes to light. I want to remind everyone that if you are unwell, more than ever you need to stay home and get tested if you're symptomatic. Our testing clinics are open and ready for people to get tested if you are symptomatic. Vaccinations will continue over the 3-day lockdown period. More information on testing clinics will be available on our website, the WA Health and WA Gov websites. Today I contacted the Prime Minister and have requested that our international arrival cap be halved from 1,025 a week to 512 a week for the next month. Given the situation around the world, with cases increasing and the stress on our hotel quarantine system, it's important we have a pause on the number of cases coming into our quarantine facilities. COVID is incredibly challenging, as we're experiencing. It's been more than a year. WA has experienced community transmission of this virus before, a year ago. but this has been an incredible result that we have achieved up till now. We need to go back to what we know best. We need to keep ourselves safe. We've all done this before and it's kept us safe. It's crucial we act calmly and sensibly to keep the community safe. I know for many Western Australians this will be disruptive. My thanks goes to everyone for their patience and understanding. As I've always said, I've been incredibly proud of Western Australia. The response of West Australians has been second to none around the world. Again, I urge everyone to heed the health advice to stay safe. We've maintained caution in abundance the whole way along this unpredictable COVID-19 journey. We need to stay the course together. Take care of your loved ones and be respectful of others, including those who are working to keep essential services and supplies ticking over. We will provide further updates as they come to hand. All relevant information will be posted on websites as it comes to hand. I'll now invite the Commissioner to address you all.
Thank you, Premier. I just wish to make a number of comments and then we can take some questions. The comments I want to make are from a state emergency and a policing perspective, and we're acting on the public health advice. That's what we've done for now nearly 18 months. West Australians have done this before, taking advice. We can and we will do this again. We've always followed the directions and advice, and this is for 3 days over this long weekend. There will be obviously businesses, people, everyone will be impacted by this. For instance, public sporting events from midnight to night, that is over the next 3 days, will only be allowed to have professional players and officials at that. There will not be, for instance, the community members allowed into those public venues. Masks, though, must be worn from 6 p.m. tonight. That is the law. This is not an option. We saw Western Australians adopt this with short notice last time we had to do it. We've only had to do this now for the second occasion in some 16 months. So we ask that for the next 3 days you wear a mask. It's for your protection and that of your loved ones. Logistically, the lockdown, we have staged this from midnight to night for a number of practical reasons. I can't deploy police to these vehicle checkpoints, for instance, on the Perth-Peel boundaries until about midnight. We've got to get those in place, and we will. But the directions will be very clear. People who are leaving the Perth-Peel area, we know it's a long weekend, I ask that you drive safely, that you don't rush. There's no need to rush. We want you to keep safe on the roads. We accept and know many people will have plans for this long weekend. If you're driving and you've made plans, don't leave this to the last minute. Just drive safely and normally. This is a precious and commemorative weekend, obviously because of Anzac Day. It's probably the most important commemorative day for our fallen diggers, and all Australians and New Zealanders know how special this is. As the Premier said, regrettably, this situation means that the 100 or so Anzac Day events that have been planned, 40 of those have been approved within the Perth metropolitan area, and regrettably, they will not be able to be held. I too will be at the end of my driveway on Anzac dawn. So if I could just repeat the public safety message. Wear your masks from 6 p.m. tonight, and you will need to continue wearing them until midnight Monday night, unless otherwise advised. Drive safely and do not rush around. We accept that this is highly disruptive, and it is, though, based on the public health advice for reasons. We need to stop this virus. We're discriminating against the virus, not against people. Happy to take any questions.
Commissioner, you mentioned that, just to clarify, that sporting events can go on with professional players and officials till midnight tonight?
Only for those professional ones. We accept that there's been obviously a lot of arrangements, and this is within hours of a number of them. So from midnight tonight, the AFL game, for instance, will go ahead at Optus Stadium, but only with players and officials. The community ticket holders will not be allowed to go.
And what about the Union and the Wildcats tonight?
So the Wildcats and the Western Force will be able to play because the directions do not apply until midnight.
And crowds or?
They'll be allowed to have crowds because the directions do not come into play until midnight tonight. We accept because there's a whole lot of logistical challenges with that. What, though, people will have to do is wear masks. So the crowd will have to wear masks at tonight's events. Everyone will have to wear masks from 6 p.m. So anyone that's planning to go to the rugby or to the basketball tonight, you'll need to take a mask with you.
How is that possible?
Look, people did it last time. We had to make a snap decision last time, and within hours people had masks. They haven't disposed of them, and so that is just something that people will have to adapt to. They did it last time, and I'm confident they'll do it again.
It's a bit different this time around, though. We know already that one person, the Victorian fella's been in contact with, has got the virus, so we know it has been out there now. Does it feel more, not so much serious, but does it feel a bit more intense this time around?
As the Premier said, there's a lot of testing clinics and the message is very loud and clear. If you're feeling unwell and you're in any of the venues at the times which the Department of Health will be shortly releasing, there's a number of venues in Northbridge. There's a number that will be pronounced, including that in and around St Catherine's College and UWA. When they're published, people that have been in those venues over that 5-day period, between the 17th and the 21st of April, we're asking all of them, you'll be either in direct contact if we know who you are, we're asking you to go and get tested.
How is it possible that we're going to have crowds tonight?
Well, that'll be at people's election. I mean, people have to make a judgment call, but the directions are in effect from midnight tonight, but we're asking people to wear masks.
But is that wise? What happens if there's an outbreak at one of these sporting events tonight?
We've taken this on public health advice.
Are you expecting a mass exodus of people heading out of Perth and the Peel regions to get away from this 3-day lockdown? And is that going to give us a health concern?
So we've already received advice that there's a lot of traffic on the roads, particularly in the southwest. We know that people will want to go and exercise their plans over this long weekend. We're not preventing people from leaving the Perth-Peel region this evening. But from midnight on, the directions do apply. You can only move about for essential reasons such as buying groceries, etc., or for work purposes. So this long weekend, you should limit your movements. But we accept the practicality of this is that people will be moving for the long weekend, and from midnight tonight is when the lockdown commences from.
Shutting the gate after the horse is bolted, you're giving them until midnight to travel wherever.
Yes, we are, but we're asking people to wear masks. There's a balance that we have to apply with this.
So if you leave Perth and Peel, you'll have to continue to wear masks?
Yes. Any person leaving the Perth-Peel area will have to wear masks, irrespective of where they are in WA.
And what about if you left, say, this morning or yesterday?
Yes, correct.
Okay.
Since the 17th.
Since the 17th, okay, great. Just on the reason for the midnight lockdown, the last lockdown started at 6 p.m. What's different?
Well, you know the time of day now, so we're approaching 3 o'clock. We've got 3 hours to try and put something into place. I simply cannot put the vehicle checkpoints up in play. We've been literally in back-to-back meetings getting results of tests. There are other people being tested as we speak. So for practical purposes, I don't want to see people rushing now and saying, well, I've got 2 hours to get out of town. We need to be pragmatic about it, and we're asking people to act responsibly like they have previously.
And so far we've only got the 2 positive cases, the Victorian man and his close contact. Is that where we are?
Yes, that's exactly where we are. So the Victorian man is in isolation in quarantine in Melbourne. The only other person that has been identified that has proven to date positive is in isolation and has tested positive. That's only been found out in the last several hours.
And the results from the family that he was staying with, have they not come back? Or
one of those persons is in fact the person who's tested positive. Other people are being tested. There's a family of 4.
So they've interacted on that first day he got out of quarantine, but also on several of the days
So the information we have is that the Melbourne man, if I could call him that, is a 54-year-old man who travelled from China. He arrived in Perth. He completed his 14-day quarantine. He tested negative on the 15th of April. He was released because he was negative on the 17th, but between the 17th and the 21st, he was in Perth. He stayed one night at a residential house and another 3 nights at St Catherine's College in a self-contained unit. That is all subject of very strict health testing and examination. So it's 4 nights in Perth, and the one person who he stayed with at a house has tested positive several hours ago. Other people are being tested.
Are experts able to say when he may have contracted it? It's definitely from the Mercure.
Look, there's not been any genome sequence testing results yet. That will take at least 48 hours.
Last lockdown, the southwest was included. Why has that not been done again this time, especially considering so many people have travel plans?
Well, the information we've always acted on is public health advice, so we've taken that advice from the Chief Health Officer.
Do the same rules apply in regards to Rottnest, so people can jump across tonight?
Well, again, if people are making plans and they've made plans, then they can move before midnight. After midnight, the directions kick into play. So again, we're asking people to be acting sensibly, do not rush, just take all the precautions, and of course, wear your mask.
How many potential exposure sites are there?
Department of Health are still doing the contact tracing. One of the challenges has been is that the man is in Melbourne, but they've been in contact with him, and we're now backtracking. The police are assisting Department of Health with that, like we did with case 903. At the moment, we're still compiling that list. That'll be published as soon as it's been consolidated, and I expect in the next few hours.
Did you use the Safe WA app?
The information I have is that the Safe WA app was used by the person with him, but we don't have at this stage any record of the individual using it. Now that's another point which I think the Premier did make. We do want people to register the QR codes when
I think that they
days. If they're further away in terms of contact, other advice we'll have to take from public health, and that will be certainly to be tested, but it'll be the Department of Health who'll advise whether they can be released earlier than 14 days.
The family.
That this, the second person that might have got it on that first day, or is it possible one of the other days that they interacted with them?
Well, look, I'm not a public health physician, but certainly the advice we've got is that it'll depend on what they call the viral load and the tests. But I think we should all just take the most cautious approach, and that is treat this as seriously as we have to. And the fact is, the other individual has turned a positive result. The information we have is that we believe it to be a more recent infection, that is in the last couple of days. But that doesn't take away the fact that we all must be very careful and wear our masks, use the QR codes, don't move about unless you absolutely have to.
Is that person a child? Is that person a child?
No.
Sorry,
No,
are you
an
saying
adult.
the woman who you stayed with, you believe only contracted it in the last couple of days?
Yes, that's correct.
Okay, and the 3 others in the family, you're waiting on their test results still?
Yes, we are.
So what about was she asymptomatic, like he was, because the 54-year-old was asymptomatic?
So look, I don't have all of that information. So there are certainly at least 3 other people in the house. The 4th was the visitor. So we think a total of 4 in that one residence. That's the information I have.
So what about those people who are planning to fly back to Perth from interstate for the next 3 days? What would it mean for them then?
So we're doing a reconciliation of people that departed, in fact, on the 21st. We know that there appears from our G2G pass records about 20 passengers that have either returned or are about to return. In fact, some are arriving on a 4:30 flight. They'll be in contact by police and health, and we'll have to determine whether in fact they are regarded as close contacts or not. There are no interstate border restrictions at this point in time.
Would you be discouraging people from going to those sporting events tonight that are before the lockdown?
Look, I would encourage, based on the public health advice, everyone wearing a mask, and you can make a judgment call on whether you want to go. You know that there's been now one infection passed on into the community, and you'll need to exercise your judgment. We're doing this for pragmatic, but based on public health advice. We just accepted, I know it sounds a bit anomalous, but there's a lot of events happening tonight. The restaurants are booked, all those sorts of things, but people are just going to have to wear their masks, be sensible, and from midnight tonight is that 3-day lockdown. The advice we have is that the next 3 days are most important for people to get tested and for the contact tracers to do their job. If the circumstances change, we'll have to adjust or ease the restrictions.
Do we
What
get the
do we know
results back
about,
from the
from
47?
Sorry, Peter?
Yeah, from the interviews that Health, I assume, conducted with the Melbourne man, what do we know about his movements while he was at St Catherine's? What has he been doing? Where's he been going?
So that's the exact purpose of the contact tracing. The advice we have is he spent 1 day in a private residence and 3 nights at St Catherine's in a self-contained unit which has its own facility, a kitchenette and a bathroom. We don't believe that he's moved about too much on the initial information, but I do stress this is an ongoing piece of work in which the contact tracers are still interviewing.
The 47 workers that were working on that floor in the Mercure, have we got their results back yet?
There are some results back of those 47. I don't have them, but they may be provided by others here.
Got a question for Health Minister. Yeah.
Why can thousands of people go to the rugby and the basketball tonight, but we can't go to Anzac Day?
There's no perfect answer here. We've discussed this during the course of the day. It's now, past 3 o'clock. We only learnt about the second case in the course of the last hour or so, and we've had to make a judgment call on what is possible to be implemented. So we took the advice of the health officials and also the police commissioner. Logistically, it was very difficult to put in place the rules at 6 p.m, so we moved it to 12 p.m. Just to allow for, one, the drafting of the rules, and secondly, the implementation of the rules. That's why we're asking people to be sensible, to wear masks, and personally, I would discourage people from attending these events tonight. My wife and daughter and I were going out for her birthday this evening. We've cancelled that. I just encourage people to do the right thing, stay home. If you go out for one of the essential purposes, wear a mask.
Do you think the public will accept this lockdown? Last time we went into lockdown, the security guard who contracted COVID, we had no idea how he contracted it, but this time it looks like it's an issue within the hotel quarantine system.
The public in Western Australia have been magnificent and terrific in understanding rules and adhering to them. And we've done incredibly well over the course of the last 14 or 15 months. And that's because we've done things that are difficult and we've applied caution, and we continue to do so. We have had a long period of normality in WA. We had one lockdown in January. Apart from that, going back to April of last year, we pretty much had a normal life. But the world is going through it, and if we're going to have returning Australians, this is the risk. Our hotels were not built for this purpose, but that's the only solution we have at this point in time if we're going to have returning Australians. And we all know Australians want to come home. So there's still 35,000 or so Australians overseas, and the number stays at about that level, who want to return back to Australia. And if Western Australia is going to participate, this risk is out there. In order to modify the risk or ameliorate the risk, I've requested of the Prime Minister we halve the number of Australians returning into Western Australia, into our hotels, so that we can reduce the risk to our state through our hotel system in light of what has occurred. I understand other states are looking at the same solution as well.
But the fact of the matter is that you knew that there was an issue with ventilation at the Mercure Hotel since early April, yet return travellers were still being able to stay there.
Yeah, so we received a report on the 16th of April, the Health Minister and I, which was a few days ago, and it said that the ventilation issues were manageable if certain precautions were put in place. And we've been putting those precautions in place. But the hotels were not built for this purpose. They're not built for this purpose. The Mercure itself has, I think, around 8 floors with hundreds of returning Australians within it. And so we've been doing our best to make our hotels fit for purpose in light of the reports we've received. But we received, at my level, that report on the 16th of April.
Anything before that? There was a preliminary report on ventilation on the 10th of March. There was a final report on the 13th.
Yeah, but just got to understand, we're dealing with full hotels. The hotels are full, and we've got thousands of people coming in through the airports. We're dealing with a system that is already operational and full, and we're trying to improve it whilst we have these people actually in the hotel. So the installation of CCTV is ongoing. We put what's called HEPA filters into the rooms where we know someone is positive in order to improve the air quality. We have ensured all of the staff working in the hotels wear masks. We've made sure that they don't have second jobs. We're requiring them to be vaccinated. We are doing a daily testing regime of all the staff in our hotels. All these things we've done progressively in order to make sure the system is as safe as we can make it. But what you've got to understand about COVID is it is insidious. Somehow it's gotten from one room into another, into 2 other rooms. It is insidious, despite all the measures we've put in place. And other states have been through exactly the same experience. In Victoria, they actually closed down hotels when they had the big outbreaks, and they stopped the importation of Australia, or they stopped bringing Australians back from overseas. They closed down a whole range of hotels. They then stripped them of all their carpets, they put in lino, they changed the entire ventilation systems. They did all of that in Victoria. They still had spread from one room to another. So COVID is very difficult to manage. But we've had around 45,000 Australians return through our hotel quarantine system, and we've had these 2 incidences, one in January and one over the course of the last week. So our system overall has worked relatively effectively, but this event that has occurred has now meant that we've had to take these sorts of measures.
So
Do
you
you admit, though,
didn't
that we
know
did-
until the 16th of April that the Mercure was the highest risk quarantine hotel?
Well, we got a report on the 16th of April, which was
was that
whatever
the
day
13th of
whatever day that was in the course of this week.
Not the 8th of April?
No, well, the best of my knowledge, a report came to us on the 16th of April.
Just on the second positive case that you say you found out about in the last hour, is that what tipped you over to going for a full lockdown? Were you going potentially for partial restrictions before you got that news?
Yeah, we were considering all options until that time. So when you have 2 people out there, and they may well have been in different locations, and one has been in Perth since the other person returned to Melbourne, well, it just made it inevitable that we had to take harsher actions. And that's all very difficult and very hard. But let's imagine we didn't, and there was spread out there, and we didn't do everything we could to control it. Well, then people would rightfully be upset. There's no perfect answer and there's no right answer. We just do what we have to do in the situation we face.
Do the people that have contracted COVID in the Mercure Hotel have to pay the cost of the hotel and the extra weeks that they'll have to do in quarantine? Is the government going to
I'm sure that the authorities will be very sympathetic to those people. We haven't considered that, but I'm sure that those things will be very sympathetically managed.
And when did the Mercure stop accepting returned Australians? Or
This week.
It was, I think it was earlier this week. So essentially we made a decision to transition the Mercure for seasonal workers. So our horticultural industries, our vegetable growers, our fruit pickers, they need seasonal workers from Tonga and Vanuatu. Otherwise, we will not have affordable food in the supermarkets. So we have to make facilities available. Other states allow them to quarantine on farms. We've said no to that. We thought that was too insecure and too trusting. And so what we're going to do is transition, or we were going to transition the Mercure to be a seasonal worker hotel because seasonal workers are extremely low risk. To the best of our knowledge, there's been no cases in Vanuatu or Tonga, so we felt that that was and health advised that that was a low risk solution to manage the situation we face. So that was the plan. Obviously, we're going to review that plan now in light of what has occurred.
Well, we have to admit that we've learnt nothing from case 902.
Case 903?
Case 903, sorry. We've learnt nothing since then.
No, I don't acknowledge that at all. Obviously, we have progressed the system. So, as I outlined to you before, and I'll go over it again, we put in place compulsory mask wearing of everyone in the red zones in hotels. We've ensured if there's ever a case that the security in the hallway or in the area in question is moved away from the identified case. We put in place daily testing regimes, daily, for all the staff who work in the facilities. We've ensured that HEPA filters go into every room where we know that there is a positive case in question. We're putting in place mandatory vaccinations for all people who work in hotel quarantine. All those measures have come into effect since the case in January.
The mining companies going back to 2 weeks on to adopt rosters. I know you anointed all the peers and chambers and Mills and Energy sort of put out a message to its members prior to this press conference that there would be a 3-day lockdown.
No, I'm not upset at all. I contacted the mining industry to let them know that there was going to be an issue, a bit like I contacted the RSL to let them know that we wouldn't be able to hold Anzac Day in Perth and Peel as we traditionally have this year. Obviously, communicating with people is important, and them communicating with their members is important. It's very sad about Anzac Day. Obviously, we'll still be able to hold driveway services for dawn services, but across Perth and Peel, we won't be able to hold the normal services out there. So that's very sad for this year. It actually reflects last year, to be honest, and I appreciate the fact the RSL has been extremely understanding.
On that spreadsheet,
Are you concerned, given that people have until midnight, that there's going to be this mass exodus, and with those people might throw the virus into the southwest, for example?
I'd urge people not to do that. I'd urge them not to do that. Logistically, we couldn't get the checkpoints and the like up in time for any earlier than midnight. So police can only work with what the resources they have and the ability they have to put these things in place. So doing it as quickly as we can. I just urge people not to do that. I just urge people, and if they're out there, and they've been out there since the 17th of April, to abide by the rules for the next 3 days to wear a mask. It's not onerous, and it requires upon people doing the right thing. But what I've seen over the course of the last 14 months is overwhelmingly West Australians do the right thing.
Why were returning Australians still being put at the Mercure after the 16th of April when you received that report?
Look, the report said that the hotels in question, including the Mercure, could continue to take returning Australians with mitigation measures put in place. And that is what we were doing. CCTV, HEPA filters, those sorts of measures being put in place. That is what the report said.
It recommended it close as a high-risk quarantine hotel though, didn't it?
Not to the best of my knowledge. That was maybe I'll get someone, Roger might be able to answer that. But we were transitioning. You've got to understand, it's got hundreds of people already in it. So we're dealing with a system that is already operational. So just closing it and spilling everyone onto the street is far higher risk than continuing to operate it and mitigate. So that is what we were. That is the way that we were operating it. But we were transitioning it to the seasonal workers, as I explained to you before.
surely it makes sense not to bring anyone new into it after the 16th of April.
Yeah, and that's what we've done.
But people, I spoke to someone this morning that arrived on the 17th of April and said,
I'll get,
Mercure?
these guys might have the exact details there.
On that same information about the riskiness of hotels, there was also the Four Seasons and the Novotel that were deemed a higher risk. Will they still be used for hotel quarantine?
So they have been used because we have been taking back over 1,000 Australians a week. But obviously we'll get some further advice as to whether or not they can be used into the future. The advice we received over the course of the last week from the 16th of April or thereabouts was that they could be used if mitigation measures were put in place. But in light of what's occurred and the fact that I've contacted the Prime Minister to say we want to halve our intake, we'll review those hotels and whether they can be used again in the future. Obviously it's quite difficult now to continue to use them for returning Australians. Perhaps they can be used for seasonal workers. But we'll get some urgent advice as to whether or not it's possible and what can be done. Clearly there's already people in them and we don't have anywhere else to put them. So the people who are in them will need to stay there until they finish their quarantine. We'll obviously look at what facilities are out there, but bear in mind we currently run 9 or 10 hotels, or 9 hotels with another one coming online shortly, to cater for returning Australians. As I've said repeatedly, this is an obligation the states have put upon us. And you know, facilities like Curtin Air Base or Christmas Island or Garden Island or Yonga Hill, the Commonwealth won't use them. So the states are doing the best we can in light of the facilities we have that were not built for these purposes.
Do you still have confidence in the senior managers running the hotel quarantine system, given the first lockdown, because they clearly haven't learned the lessons from elsewhere, and guards have sat outside the rooms without masks, and we now know that for weeks they are aware of independent experts telling them that the Mercure is the most dangerous hotel when it comes to transmission. Are you still confident in the people running it?
Yes, but I'll say this, as I said before, we've had around 45,000 Australians return, and we've had 2 incidents out of 45,000 in hotels that were not built for this purpose, but we've had to use them for this purpose. So every state has had these issues. Every state, Adelaide, Sydney, Melbourne, Brisbane, they've all had it. Other states, Darwin, other states, Tasmania, I don't think they've taken returned Australians. So it has been a system we've had to put together over the course of the last year. We've now had 2 incidents and we've dealt with them the best we can.
Is anyone staying at the Mercure Hotel as we speak?
Yes, there are.
And what about in regards to how that's being managed, staff who are caring for them? Are they having to go straight from work home? Are they able to?
Well, as I've outlined to you, the situation as exists at the Mercure Hotel, all of the rules that we put in place around hotel staff are being applied at the Mercure as we speak. So the security guards and the cleaners, anyone entering the red zone, are required to wear full PPE. They're all required to be tested, saliva tested on a daily basis, PCR tested on a weekly basis. If they go on holidays, they're required to be tested on a number of days over the time they're on holidays. You know, the filters are put in the rooms, as we did with the Mercure when a positive case was identified, and this is a particular piece of equipment that does that. We're bringing in laws by May 10 to ensure that there is full vaccination of anyone working in these facilities. So a whole range of measures being put in place to make sure that we're as safe as we can possibly be.
Are you urging other states to stop accepting West Australians?
No, other states can make decisions they would like to, I'll just say to other states they can make whichever decision they wish to. So we'll do the 3-day lockdown. We'll obviously ramp up testing over the course of the next 3 days, and we'll be able to make a decision on Monday as to whether or not we extend or what other rules we put in place.
Do you have any further information on why the Southwest wasn't included in this particular lockdown?
Well, it was health advice. So Perth and Peel, you know, we've refined it over time. Bear in mind we've been going through this now for 15 or so months. You refine and learn from what happens here and what happens in other states.
Do you know what this
Who's health advice? Because the Chief Health Officer isn't here.
The Deputy Chief Health Officer is here and the Chief Health Officer was on the phone.
do you know
Where is Andy Robertson?
I don't know, but he's on the phone. He was on when we have emergency team meetings, so just so you know, we had I think 4 today, from early this morning. I think it was 4 or maybe 5, and spoke to him on the phone.
Why is he on leave when we're about to go into lockdown?
Well, we only learnt about this today, so he took some leave. I don't think there's anything wrong with that, and we learned about this today and he's come back.
Anyone outside the Perth or Peel region, they can return to their home. Is that the advice?
Yes.
Even after midnight tonight?
Yep.
What's the rules for Rottnest? That fall into Perth?
Yeah, well, as we said, there's 4 rules. The Commissioner might be better to answer this than me, but there are 4 reasons for people to leave home, as I outlined before. So they are shopping for essential purposes, medical appointments, work if you can't work from home, or exercise with the appropriate masks or vigorous exercise. You don't have to wear a mask. Obviously, going to Rottnest wouldn't fit within those categories,
The ferries got shut down
unless you work there.
The ferries got shut down last time, though, didn't they? So surely that will just happen again and it'll be dialed in the
Look, I'm sure we'll manage that. Yeah.
Premier, I'm still confused in regards to the report that detailed that there was a ventilation issue at the Mercure Hotel. We understand that that was released on April 8th, but you're telling us that you were only made aware of it on what, April 16th?
April 16. It was, as I understand, the Department of Health or Chief Health Officer received it some days before. A copy was forwarded to me on the 16th of April. The individual in question was released on the 17th of April. But in any event, just so you completely understand, the report said that the issues within the hotels could be mitigated with measures put in place, and those measures have been progressively put in place.
We've also recommended that the Mercure be shut down and not used to house high-risk returning travellers.
As I said, so the 16th of April was in the course of the last week or so. We currently have hundreds of people contained within the Mercure. We don't have anywhere else to put them. So we have been dealing with an operational hotel and trying to mitigate risk within the hotel over the course of that period of time, and indeed over the course of the whole time that COVID has been around. We currently have 9 high-rise hotels, big hotels, full of returning Australians, with thousands of staff managing the system. It's actually an enormous logistics operation. It's a military-style operation on a grand scale that has never been done before, and we're doing it with facilities that were not built for this purpose. So, therefore, we do the best, and we put in place as many measures, and I won't take you through it for a 4th time, that we possibly can to mitigate risk.
So you were saying that all other...
We've already had a second case related to this fellow who came out of the hotel, the woman who stayed with. If we keep having 1 or 2 cases a day, will that see the lockdown extend? Is the lockdown
that's dependent on health advice. Obviously, if there's community spread of the virus, that will mean we may have to even take harsher measures. But we'll just have to wait and see what the testing regime throws up. I just urge anyone who is feeling unwell to get tested. Anyone who's been in any of the locations that will shortly be published to get tested. Anyone who's a close contact to get tested and quarantine. Anyone who's on the flight to Melbourne to get tested and quarantine. They're the rules we're putting in place. By the way, this is not unusual. The other states have been through this. We have actually been through this before. I know West Australians understand that this is something that has to happen. Other parts of the world, of course, have thousands of cases a day. Britain and France and India and America and the like, they have thousands of cases a day. We have had 2 cases here. But because we have been so successful as a state, because we have eliminated the virus within Western Australia for 14 months, we just want to continue on that pathway. We want to make sure we keep the virus from spreading throughout our community.
So do you know if this woman who was infected by the Melbourne man, do you know if she's asymptomatic like he was, and how much of a concern is it that he was asymptomatic?
Asymptomatic or symptomatic?
The Melbourne man was asymptomatic, he didn't have symptoms. Do
Yeah.
you know if the woman that he stayed with was also asymptomatic?
No, we don't. We got a test result this afternoon, just before we came down here, maybe an hour before. That indicated she was positive. She may well have become positive recently, but were we to assume that would be a risk. and we didn't want to take a risk.
So
How is
Connie, are
it
you
that
saying
the
that
Melbourne man was able to return a negative test result and then be released and turn out to be positive? What's the working theory on what's gone wrong?
Well, that's because we think when he came into the hotel, he was not positive, but the seepage of the virus from the room with the people from India in the hotel came to his room, and he was across the corridor and down the hall. And so therefore, when he got the final test before he left the hotel, he was still negative, but he became positive in the day or days after that.
So Connie, what you're saying is that all the other hotels were full, which is why people were still being taken to the Mercure as late as Monday this week.
We have 9 hotels with 2,228 people in them. 9 hotels with 2,228 people. We have thousands of staff working in these hotels. I think you just got to understand the scale of what we're dealing with here. This is a massive logistical exercise. We have people transporting them from the airport. We have people managing hotels. We have health staff. We have doctors. We have cleaners. We have security. We have administrators. We have transport. We have army. We have police. All of these things are all ongoing at any one point in time, all to try and keep ourselves safe. And we have hotels that were built in the 1970s or 1980s or 1960s that we have repurposed for this purpose. And so that's why it is the best system we've been able to devise in the circumstances, but it is not a perfect system.
When was the plan to have it stop taking high-risk travellers?
I'm sorry?
When was it going
I'll
to
let
be-
Roger answer that. Yeah.
And can you just confirm, sorry, that FIFO work is still going ahead as normal, is that the case?
So, one of the exemptions, as I outlined to you, the 4 exemptions over the course of the next 3 days. One is work, where you can't work from home. One is medical appointments, or to look after vulnerable people who can't look after themselves. One is for exercise for an hour a day, where you wear a mask unless it's vigorous exercise, and the other one is for essential purposes, shopping and the like. You've got to go out and buy groceries or whatever it might be. They're the 4 exemptions. So work is an exemption. So therefore FIFO work is exempted. But I have contacted the Chamber of Minerals and Energy. I've told them what's happening. I've asked them if swings can be extended on mine sites, as unpleasant as that is. If that can be done, if that can be managed, that would be a good thing. Thank you very much.
Minister, the written advice dated April 16 from the Chief Health Officer to the Premier saying that the Mercure should shut because it was high risk. We referred to March 10 initial advice about ventilation being received by your department, and then final advice being received at the end of March. So did your department know for 6 weeks or more that the Mercure was not fit for purpose?
Well, let me make a couple of comments first, and just to provide you with updated information in relation to the testing. So I can confirm that the children of the second case have both returned a negative result. So that is obviously a very good outcome in relation to the current situation. To your question, Natalie, our understanding is that she is asymptomatic, but she also had a high CT score, which would suggest that she was very early on in terms of her experience of the disease. So, and you can imagine that's borne out by the fact that now her children have delivered a negative result. So that's a good outcome. And just to the question with respect to the last last accepted passengers at the Mercure on the 17th of May, 17th of April. So to your question, Peter, now obviously I just want to take you on, step you through the processes that have been going on in relation to the management of our hotels since case 903. Obviously, we've had a number of pressures, both in terms of our hotel, the cap, the international cap that we have to bring in, but also the pressures in relation to wanting to accommodate seasonal workers. As a result of the case 903, we vacated the 4 Points Hotel to make sure that we could understand the full situation with respect to that. That led to the Weeramanthri report and the subsequent engineering reports into ventilation. They were both considered over late March and early April and were finalised on the 8th of April. Now, in relation to that, the reports made very clear that all hotels were suitable for hotel quarantine. However, that we would need to take mitigation steps to ensure that they could meet the standard that we required. In addition to that, it observed that of the 10 hotels that were currently being considered, that some were better than others, and in fact, 3 of them weren't as good as the others, and they were the Mercure, the 4 Points, and the Novotel on Langley. As a result of the analysis undertaken by the Chief Health Officer, and as a result of commissioning contracts that were taking place with the Adelaide Hotel, we had a number of opportunities. One, as a result of the Adelaide Hotel coming on stream in late May, it meant that we could move away from one of the hotels that was part of our current cohort of 10 at that particular point in time. We also had the pressures in relation to seasonal workers, and we're doing our best, working with Minister McTiernan and the industry to make sure that we could accommodate seasonal workers in Western Australia to support those industries that depend on them. The analysis provided to us by the Chief Health Officer was that even though the hotels were of a good enough standard, as a result of the mitigation efforts that were being put into place, and the Premier provides you with those details, we should take the opportunity, given that the Adelaide was coming on stream, to retire the hotel that was least best fitted. Now, obviously, the Mercure Hotel, as a result of its older ventilation system and the fact that you could open the windows, was the one hotel that presented a higher risk, but not unacceptable risk. So the Chief Health Officer, out of abundance of precaution, decided that we should utilise the Mercure Hotel for the seasonal workers because they represented a much lower risk profile and therefore were suitable to the Mercure, and that we would then take advantage of the Adelaide to continue to maintain 9 hotels. Now, I stress 9 hotels is pretty much the limit for our system. That's the system operating at full capacity, and we wanted to make sure that we didn't overstretch our system.
So did you get that advice on the 8th of April?
No, the government received that advice on the 16th of April via the Chief Health Officer. Obviously, the Chief Health Officer was considering that advice in terms of providing his recommendations to the government. Well, look, they are complicated issues. They involved analysis by a range of engineers, public health and ventilation experts, and as a result of that, the Chief Health Officer had to analyse that work and, amongst all his other obligations and duties, provide that advice to the government. Now, he did so on the basis that the reports all said that the mitigations that the Premier has detailed would be sufficient to maintain a standard. So on the 16th of April, we said, yes, you're right, Dr. Robertson, this is time to transition away from the Mercure. And as the Premier said, we continue to have a number of passengers in that hotel, so they had to finish their time in the hotel. We were going to re-equip it, recommission it under the lower risk regime.
I'm sorry, Minister, this doesn't make sense. There's a report that's made public online that has the list of quarantine hotels and detailing which ones have adequate ventilation or not. And that's dated to April 8th. But how come you were only made aware of that on the 16th of April? That's a week. No,
so that's the time in which the information was private to the Chief Health Officer, and then the Chief Health Officer, as you saw by those documents which we made available to the public, gave his advice to the government on the 16th of April.
After the last lockdown, you were very quick to say that it proved that the WA Health System's contact tracing was effective, it stood up, it was proven. A couple of months on, we're going back into lockdown. Does that show a lack of faith from the government in contact tracing? No, contact tracing is an important element of understanding any spread of the disease, as is testing. And I'd just like to reiterate the points that the Premier made. If you are feeling unwell, please get yourself tested. But in particular, if you had been to any of the locations which we will detail in this afternoon,
and you are feeling unwell, please isolate and get yourself tested as a matter of priority. These 3 days will provide our contact tracing teams the opportunity to make sure that while we limit any potential spread, that they get the full range of information and intelligence that they can provide to us, so we can strategically step through next steps.
Do people need symptoms to get a test, or can they just turn up?
Look, if someone had been to one of those locations and they were feeling that they should get themselves tested, all our teams are on standby till 10 p.m. tonight, and I'm sure they would make the test available to them.
How many exposure sites are there?
Well, as the Premier said, and the Commissioner reiterated, we are still getting information in relation to the exposure sites. The Premier detailed where this gentleman had been, a number of restaurants, swimming pool, and so on. And obviously, once we have done the full contact tracing via interview with the second case, we'll make that information available, and we thank the media for assisting us in getting that information out.
Are you worried at all that people have become a bit lax with the scan-in system, the Safe WA system?
Well, you're right. Safe WA app is a really important measure that we will rely upon to get a quick understanding of how many people have been to those locations at the time that the first case or the second case have been there. And this is another reminder to everyone that even though in Western Australia we're doing a great job of keeping control of the virus, keeping it at bay, trying to protect the West Australian community, we all have a responsibility in relation to that exercise. And that means continuing to use the Safe WA app, making sure you take all those measures that we need, and of course making sure that you listen to any directions that are provided to ensure everyone can stay safe.
People that are currently at the Mercure in quarantine are really worried about these reports asking, should I be turning the aircon off? Seepage they're talking about, windows are open, you know, any advice to them?
Yeah, if you've got concerns, in any of our hotels, we have health and welfare teams and obviously members of the hotel quarantining system who can provide guests with advice about what they should be doing in their circumstances. And that includes, obviously, if they're feeling unwell, to contact the health and welfare teams. If they're feeling anxious, to contact the health and welfare teams. Take the guidance and the directions that you're given.
There's a pregnant mother who's contracted COVID while in hotel quarantine in Perth after getting through the UK without contracting it as a nurse. Pretty hard to accept, would you agree?
Look, it's a great reminder that this disease is out there. It's out there. We are always managing the risk associated with COVID-19. The only way we can eliminate risk is to stop anyone coming into the state. And of course, we need Australians to be able to come back home. So once we've stepped across that threshold, once you accept that we need that people have a right to come back into Australia, well, then you're managing the risk, and you'll never eliminate that risk, but we endeavour to keep it under control and to a minimum.
But has she been let down by the WA government?
Well, look, we want to continue to stand by her, provide her with all the health advice and assistance that she needs. Obviously, this is a regrettable situation, but it's a reminder to everyone that this disease doesn't discriminate. It also means that whenever that it's out there, and that we need to continue to be very careful.
No crowds. Sorry, crowds at the Force, crowds at the Wildcats. No crowds at the footy. No crowds at dawn service. Like, where's the common sense in this?
Well, look, public health is not. Let me just say, look, public health is not perfect. We put these measures in place because we need to minimise the risk, balanced against the practicalities of putting these measures in place. As the Commissioner explained, we've got people who are literally already on their way to those sporting events. We've got we've got people who are already away travelling for this weekend, and the police can't set up roadblocks straight away. We simply have to put things in place in a manner which is practical and is informed by the public health advice.
That Cardinia woman, has she been at work during the time she's been infectious?
I don't have that information, and obviously that's information that the contact tracers are endeavouring to collect as we speak. Sure.
In terms of the health advice around the southwest not being part of the lockdown area at this time, can you talk us through what the difference is compared to the February lockdown?
Well,
Well, any of these decisions are a balance between what we perceive to be the risk and the pragmatism and the sort of difficulty in doing things, and the practicalities of it, as we've already heard. And we learn from our experience previously and learn from experience in other states and territories when they go through one of these lockdown episodes. So remember with case 903 that the Southwest was included in the first 5 days of that lockdown, and once that was reconsidered and the risk was re-looked at, then it wasn't included. So we think that the Perth region and the Peel region are contiguous, and that we have to put a boundary somewhere. We didn't include the Great Southern last time, for example. So that's where we've landed.
So the Western Force kicks off at 5:45. People don't need to wear masks for the first 15 minutes.
I think that common sense would indicate that they should be wearing masks, and I'm sure.
Indicate this match shouldn't be going ahead.
Well, again, it's a balance between the risk and a proportionate response and the practicalities of it, and we've already spoken about that. And it's not as if there's no mitigation happening at all. There's a requirement for these people at those grounds to wear masks, and masks are a very good way of mitigating risk of COVID, not only for a person who may have it, preventing them from spreading it to somebody else, but for people who aren't infected with it, and if somebody else next to them is, from getting that infection. So it's a balance between the practicalities and the risk, and it's not without its mitigation by using the masks.
What does the health department know about this gentleman's movements for the 5 days he was in Perth? What was he doing?
Well, this gentleman, as we heard, came from China, so he was...
What was he doing in Perth while he was out and about? That's what I'm keen to know.
Yeah, so I was saying he's a tourist here, so he did tourist sort of things. He went to lots of cafes, restaurants, he went to Kings Park, he went to a swimming pool. He was out and about. And all of that information will be posted on the Department of Health website shortly. And the question earlier on was how many venues are of interest at the moment. At the last count there were 10, but there's further contact tracing going on. That was before we have the full contact tracing information from the second case. But important to know that the second case and the first case were together a fair bit of that time, so a lot of those venues will cross over. So there'll be some additions to it, but it won't be as if it's a brand new case that hasn't been to those same venues as the other person.
Had in your family a close contact with them, one of them is infected. Do we know if he had many close contacts while he was going to these restaurants, cafes, out and about doing the tourist thing?
Well, that's what the contact tracing team is hard at it at the moment. Well, they're in the middle of that at the moment. I haven't got the details of how many close contacts versus casual contacts, because that's important. The close contacts, people who are deemed close contacts will have a higher level of restriction placed on them, and that will be that they need to go into quarantine for 14 days and be tested at least twice along the way. Whereas casual contacts, the advice will be that they should get tested and stay at home until their results come back, and then they are free to go.
And has he told you how many close contacts he believed he had?
I haven't spoken to him directly, but the contact tracing team will have that information and they're pulling it together, and they have been throughout the day.